moving back to the person, let's say that they're of the two categories. They have really bad teeth and gums, and they're worried they're going to end up in a denture. Maybe they were told in another office, your only option is a denture, or the actual denture wear. So what are their options in your practice when it comes to dental implants?
So when we see people come in for dental implants as a consult, we always go through the options with them. The first option is we can place 2 implants down on the lower jaw, we'll talk about, and then they can have a denture made that snaps in, snaps out.
Okay.
The problem with those is that it's still tissue supported in the back and that denture moves around if they eat.
Okay.
And they're able to take it out, clean it, and it's, you know, it stays in for the most part. They can chew with it. So they have that option. The next option, we can maybe add 2 more implants. So we can go with 4 implants. So we can get the back supported a little bit better. They snap in, snap out.
Okay.
Yes. There's a little more maintenance to those, and that we still have to see them maybe twice or 3 times a year to change out the little snap-in parts.
Can they eat with them pretty well?
They can. They can eat with them pretty well, yes. And then on the upper, you know, we can still do the same thing. We can put 4 or 5 implants on the upper, snap in, snap out, but they still generally have a palate that covers taste buds and things like that on top. Then the option that most people are interested in is when we can do a full new set of teeth, upper and lower, that are in their jaw with implants.
Like how many implants typically?
So on the lower we can do 4 or 5 implants, and on the upper we can do probably 6 implants, and they'll have a full set of teeth in there. Chew anything that they could chew before with their teeth when they were healthy, before they had gotten broken down to a certain point.
What do they like more, the way it looks or what they could eat?
Well, that's so dependent on the patient, because you'll have people come in that'll say, you know, like the previous patient that I talked about, he was just interested in being able to chew better. You know, I just want to be able to chew. But then you fix him, you give him these teeth, and he's like, oh my goodness, it's opened up a whole new world. Or you have people that want to come in and just say, I want this to look better. I just want to look good. My grandkids are asking me about my teeth all the time. Why do they come out? Things like that. They just want to look better. And in doing it, they end up restoring their bite. They're able to chew corn on the cob, things like that again, that they never were able to enjoy for so many years. So as an example of one of the patients that comes in just wanting to have a better bite, being able to chew better, things like that, my dad was a perfect example. I didn't ever know it, but he was missing almost all of his back teeth at one point, and that was really important to him to be able to chew again. And so we did all kinds of dental work on him, and he, again, the same thing, he became a different person because it changed his look. He went on to different schooling. Like, he was just over the top about that he had been able to have his teeth all fixed like that.
Now, I think we've talked about this, but if you're missing teeth in the back, why is that such a problem, other than maybe the obvious for chewing? But why should somebody do something about it?
So if you're missing back teeth and you're chewing on your front teeth, they start to flare out, and they'll get spaces between them. They're not made to do that chewing like the back molars are. And so pretty soon somebody's face gets shorter, their teeth are flared out.
So you end up losing your teeth?
Yes, you end up losing them then, because the bone isn't supporting them any longer, and it's a problem.
So is that kind of a straightforward procedure? Somebody's missing back teeth, put in some, I'm making it sound simple, but you put in some implants, and they're chewing again. And and it's going to prevent them from losing more teeth in the future?
Yes, so there are situations like that where if we like to save teeth, you know, don't get me wrong. If we can save teeth, that is the superior, you know. But also you hit a point where some teeth just aren't, we're not going to be able to keep them in there. And if you're looking 3-5 years down the road, I want to be able to share that with people. What are our options here? And give everybody the best option for them at that point.
Okay.